Hello, everyone. Good afternoon, everybody. I'm Priyanjali from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like freckle-like spots forming large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to study conducted across 4 Indian cities, revealed that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more susceptible to pigmentary disorders. It occurs mainly in women, which is 90%, and 10% of all male ethnic racial groups. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Melasma and hyperpigmentation is generally ignored as a sign of aging and is often misunderstood as a skin condition. Melasma sufferers have been misinformed as aspects of this common hyperpigmentation issue. This can lead to frustration setback in treatment. To avoid all these hassles and to keep you informed today, we are here to know about management of melasma from our expert. So let's connect today with our skin expert, Dr. Nidhi Rohatgi from Delhi. Dr. Nidhi Rohatgi is a highly experienced senior consultant dermatologist, venereologist, and aesthetic physician practicing with SDA and Fortis Hospital, Vasant Kunj, with more than 24 years of expertise in treating various skin, hair, nail problems, and sexual transmitted diseases. She has special interest in performing cosmetic procedures such as Botox, fillers, derma roller, PRP therapy, as well as the removal of skin tags, warts, and other skin irregularities. Her extensive experience and dedication to provide high quality care make her a trusted professional in the field of dermatology and aesthetic medicine. With her expertise today, Doctor will enlighten us more on melasma and hyperpigmentation. So over to you, Doctor. What is melasma?
So hello, everyone. I think everybody knows what melasma is. So when you see black patches happening mainly on the cheeks, but you can have them on your forehead, around your eyebrows, upper lips, then it is known as melasma. When you have this kind of pigmentation in pregnancy, then it is known as chloasma, but by and large, they are the same things. In Hindi, we call it jhaiya. So in Hindi, we call it jhaiya. Exact cause why melasma happens, we don't know. We call it idiopathic, but a lot of women get it when they are pregnant or when they are on oral contraceptives. But by and large, it's idiopathic. The exact cause of melasma is not known.
So, right, Doctor. Yeah. So now that we know what is melasma, Doctor, our next question for you would be, what are the causes of melasma?
So basically, as I said, we don't know why melasma is happening. Causes could be hormonal, genetic, but by and large, I have seen that the days patients are not sleeping well, when you are under stress or when you are going out in the sun, it looks more prominent. Then there are days when your life is going smoothly, you are in a happy phase and you're sleeping well, you're not under stress, it looks lighter. So basically, melasma also reflects your lifestyle.
Right. Doctor, there is also few confusions regarding melasma and hyperpigmentation. Can you please clear out the air between what are the differences between melasma and hyperpigmentation?
So basically, hyperpigmentation is a very loose term. Any kind of dark patches happening on face or anywhere else on the body is hyperpigmentation. Now, why is this hyperpigmentation happening? For that, we have to diagnose, if needed, investigate, and then make the diagnosis. Like, for example, melasma is a clinical diagnosis. By looking at it, any dermatologist can tell you, okay, you have melasma. So it's a part of hyperpigmentation. So all melasma is hyperpigmentation, but all hyperpigmentation is not melasma. There are different reasons for hyperpigmentation.
So I believe the last line, which our doctor has just said, that all hyperpigmentation are not melasma, but all melasma are hyperpigmentation. That line itself says everything. Now that we know the difference between melasma and hyperpigmentation, doctor, our next question for you would be, are there any signs or symptoms of melasma?
So obviously, melasma does not give you any symptoms, except that it does have psychological impact on my patient. Like, so because it is happening on the most prominent part of your face, you become very conscious about this melasma.
Right.
But more than that, there are no symptoms. It doesn't harm you in any way, except that, people are very conscious about this melasma.
वेल डॉक्टर, हमारे बीच आज जितने भी व्यूअर्स हैं, काफी लोग ये सोच रहे होंगे चलो हम मिलाजमा के बारे में बात कर रहे हैं, हम जान रहे हैं मिलाजमा क्या है, वी आर आल्सो गेटिंग टू नो अबाउट हाइपर पिगमेंटेशन, पर डॉक्टर अगर किसी को है नहीं मिलाजमा और ही और शी वांट्स टू save themselves from having melasma, how can they do so?
Now that's very tough. You cannot prevent melasma. All that you can do is you can reduce the intensity of pigmentation, or maybe you can delay it for some time. But usually you cannot prevent melasma. But the minimum that you can do is put a good sunscreen. You should know your sunscreen well. You should repeat it whenever needed, and also along with the sunscreen, have a physical barrier. But like, you can't be scared all the time, okay, I might develop melasma. It doesn't work like that. But if there is a family history, like if your mother has melasma, or your sibling has melasma, or your father has melasma, and males also have melasma, then you can take little extra care of your skin by using a sunscreen.
Right. With that, doctor, we will quickly move on to the next question. Our next question is, are there any risk factors of melasma? If so, what are those?
So everybody knows, whenever you are out in the sun, you will have more melasma. Darker skin is more at risk of getting pigmentation or melasma, because we have more melanocytes, and obviously if you have more melanocytes, and if your melanocytes are more active, you'll have more melasma. So it's basically the color of the skin and the exposure to the sun. Right. And also if you're on oral contraceptives, or if you're pregnant.
Okay. So these are few cases where we can, suffer from melasma. Doctor, also tell us, how do you diagnose melasma?
As I said earlier, melasma is a clinical diagnosis. By just looking at the face, we can diagnose whether you have melasma or any other hyperpigmentation. Besides that, we can also do a biopsy if needed, but usually biopsy is avoided, because obviously you are having pigmentation on the most prominent part of the face, and if I do a biopsy, I'll leave behind a scar, which is not needed. So you don't need to do any biopsy. You make a clinical diagnosis. One thing that you must keep in mind, that if your pigmentation has got well-defined borders, and if it's blackish, that means it is in the superficial layers of the skin. Chances of treating this kind of pigmentation is easier. Whereas if your patches are little, grayish or bluish, and the margins are not very well defined, that means that your pigmentation is happening in the deeper layers of the skin. The prognosis is not very good.
Okay. Doctor, tell us, what are the early stages of melasma? Suppose a person who has never heard of it, or maybe he or she does not have any particular idea regarding it. तो शुरुआती फेज में कैसे हमें पता चलेगा कि हमें melasma ही है या ये कुछ और नहीं है?
See, one consultation with your dermatologist is very important, because if you're having other causes, like if you're suffering from something else, so there are different ways of treating different conditions. So one visit to your dermatologist is important. The moment you see black patches, please go and visit your dermatologist at least once. There can be freckles, there can be lentigenes, there can be melasma, and then they can guide you properly. So I feel one visit to your dermatologist is important.
So people usually, in our Indian society, हम देसी नुस्खे बहुत अपनाते हैं. So whenever we see any mark or any pimple, we tend to, apply all those household remedies. So what are your points on those?
So household remedies are not bad. Only thing is that uska effect will take little longer, and people tend to overdo it. I have seen in my OPDs people coming with irritated skin because they've been putting potatoes or tomatoes on their face for so many days regularly, or if they are doing a lot of scrubbing. So one has to remember that there is something known as frictional hyperpigmentation. Like if you scrub your skin too much, you can land up having even more pigmentation. So exfoliation and scrubbing has to be limited if you have a tendency of hyperpigmentation. Also friction, friction I've already said. Like if you're sleeping, and if you're putting a lot of pressure on one side of your face, you will have pigmentation over there. So my point here is that one visit to your dermatologist is important, because they can guide you where you are going wrong. Gharelu nuske mein, you were just asking me that milk has got lactic acid. It's a very good clarifying agent. Potatoes also have got antioxidants. So, but it has to be done not very often. like you can't do it every day. You have to be
Right.
careful while using DIYs.
राइट डॉक्टर, इवन दो काफी लोग घरेलू नुस्खे अपनाते हैं, बहुत लोगों के लिए वर्क करता है, बहुत लोगों के लिए नहीं करता है. सो व्हाट डू यू हैव टू से अबाउट फॉर दोज पीपल? सबको लगता है कि चलो तुमने बेसन लगाया, तुम गोरी हो गई, तो मैं भी लगाऊंगा, मैं भी. बट in all the cases it does not happen the same. I have seen people ki tomato se bahut redness ho jata hai. We have heard ki tomato tanning remove karne ke liye, skin whitening ke liye bahut help karta hai. But I have also seen people ki rashes ho ke the entire skin has turned red. So what do you have to say to those viewers who are watching us and who thinks that ki chalo sabke liye kaam kar raha hai, to mere liye bhi shayad kaam karega?
There is a difference between tanning and melasma.
Right.
And tomato potatoes, they work only to very very little extent. अगर आपको झाइयाँ है, melasma है, you need to take a proper treatment, because tomatoes and potatoes are not going to help you with your melasma. For sure, they might help you a little bit with your tanning, but not with your melasma. So it's better to put the medicines from the beginning only. And you
Right.
should know what medicines you are putting. Avoid putting steroid-based creams.
Well, viewers, we have heard that precaution is always better than cure. तो हमारी डॉक्टर जो आज हमारे साथ है, वो बार बार एक ही चीज आप सबसे कह रही है कि प्लीज एक्सपर्ट के पास जाए. आपके सामने जो भी एक्सपर्ट मौजूद है, सबसे पहले उनके पास जाए सजेशन के लिए. टेक द सजेशन एंड देन टेक एनी स्टेप. आज हमने बहुत सारी पॉसिबिलिटीज जाना है जिनमें हम यूजुअली जो फेस करते हैं हमारे डे टू डे लाइफ की, चलो ये भी हो सकता है, ये भी हो सकता है, पर सबसे बेस्ट सोल्यूशन आपको आपका एक्सपर्ट ही दे सकता है. विद दैट विल मूव ऑन टू द नेक्स्ट क्वेश्चन. डॉक्टर, आवर नेक्स्ट क्वेश्चन फॉर यू इज how do you, well, we have already heard it from you that prevention of melasma is not possible. पर अगर हमारे व्यूअर्स आप सभी आपसे ये पूछना चाह रहे हैं कि कैसे, मतलब थोड़ा सा भी अगर हमारे कुछ करने से अगर प्रिवेंट कर पाते हैं, सो व्हाट वुड बी दोस स्टेप्स? कैसे हम प्रिवेंट कर पाएंगे melasma से सफर होने? I mean, how can we stop ourselves from having melasma?
Sunscreen, sunscreen, and sunscreen. You have to pick up your right sunscreen. You should know that for an Indian skin, any SPF above 24 is okay. The compliance is important when you're picking up your sunscreen, and one application daily of a good sunscreen is important. And also remember, if you are suffering from melasma, along with the sunscreen, you should try to have physical barrier, like you can have a cap or a hat and put big sunglasses and stuff like that. And you should, like, one application, we say once in a day is okay if you're indoors, but if you're stepping out in the sun, it's better to repeat your sunscreen after 4-5 hours. So sunscreen has to be repeated, and you have to buy a sunscreen which is sweat proof. So, and then there are different kinds of sunscreens. There are chemical sunscreens, there are physical sunscreens, there are mineral sunscreens. Now, when we advocate so much of sunscreen, one has to remember that one anyway is low in vitamin D3. So whenever I tell my patients to use so much of sunscreens religiously, I always tell them that you must take your vitamin D3 supplements, because anyway you are low in vitamin D3. And when I'm blocking so much of sun, please take your vitamin D3 supplements. That's very, very important.
Doctor, speaking about sunscreen, there, what we tend to do is, जब हम घर से बाहर जाएंगे तब हम क्रीम अप्लाई करेंगे, जब हम घर से बाहर जाएंगे तभी हमें सनस्क्रीन की जरूरत है. What's your take on that?
So you have to know your sunscreen. As I said, there are broadly two types of sunscreens, physical and chemical. So if you're using a chemical sunscreen, first you should put your sun protection thing, and then you put your moisturizer. So when you're using a chemical sunscreen, you have, first layer has to be of your sunscreen and then the moisturizer, because it is coming into contact with your skin and it absorbs the UV rays, it neutralizes it. And for chemical sunscreen, you have to give at least half an hour before you step out in the sun. But if you're using a physical sunscreen, it has to be the topmost layer, because it kind of reflects the UV rays. That can be put, and then you can immediately step out in the sun. So it depends which sunscreen you are using.
Okay. So, well, this is something really new, which I have come to know today, that there are also differences between sunscreen, and you should know the application of your sunscreen. So please, कुछ भी करने से पहले, as I said, as doctor is saying again and again, consult your expert. Doctor, how important is it to apply sunscreen even though when you're inside your home or your house?
So as I said, Like we advocate proper cleaning, toning, moisturizing at least 2 times in a day. So in the morning, instead of putting your normal moisturizer, put a moisturizer with SPF, because even through the windows and all your UV rays are coming inside. So one application of your sunscreen in the morning is recommended.
Right. Well, I think जैसे आप सुबह उठ के ब्रश करते हैं वैसे ही आप अपने स्किन को हेल्दी रखने के लिए डेफिनेटली ये सारे प्रोसीडियर्स अप्लाई करें. इट विल definitely benefit you, as doctor says. Doctor, our next question for you is, there are some misinformation about melasma. I think we have already got an answer to the question about the misinformation between melasma and hyperpigmentation. There is also a myth, doctor, that melasma can cause cancer. What do you have to say about that?
I don't think so. I've never seen anyone's melasma turning into a cancer. So I don't think so.
Okay. Well, the myth has been cleared, viewers. If you are scared regarding that matter, I don't think so. In fact, doctor says that there isn't anything such which is going to happen. Doctor, is melasma due to some allergy, or is it some sort of infection?
Neither it's an allergy nor it's an infection. It's just that your melanocytes are overactive. For some reason, the exact cause, as I earlier told you, is not known. Some people feel that it's because of some blood vessels and too much of blood circulation or too many blood vessels happening, but nothing is known exactly what is causing pigmentation. Yes, if you have it while you are pregnant, or if you were on oral contraceptives, and if you once you are delivered, after a few weeks or months, your melasma usually disappears, and if you stop your oral contraceptives, it will gradually disappear.
So, doctor, for all the people who are already suffering with melasma currently, is it possible that they can, get rid of it entirely in their future days?
Okay, so when you come to us, and once we examine you and know if your pigmentation is happening in the upper layers of the skin or deeper layers of the skin, depending on that, the prognosis is explained. So I always tell my patients that, whenever we prescribe medicine, give it at least 3 months. And even if your pigmentation disappears, the recurrence is very common with melasma. So once or twice in a week, you have to continue to apply the medicines, these medicines which are known to reduce the pigmentation. So I don't think there is permanent cure for melasma.
Okay. Okay. I think we have few questions coming up from our viewers. We have Rohit John asking us, are there any lifestyle changes that I can make to manage melasma better?
Of course, melasma reflects your lifestyle. If you lead a healthy lifestyle, like in terms of sleeping well, not taking stress, when you are stepping out in the sun, taking all the precautions, your melasma will become lighter. So there are days when people will say, oh, your pigmentation is looking too much. And there are days people will tell you, okay, today it's looking much better. So basically it reflects your lifestyle. So you have to lead a healthy lifestyle to for your pigmentation to look less. Yeah.
Right. Right. Doctor, we have another question coming up from Firoz Khan. He asks, what is the prognosis for melasma?
So if you're very regular with your treatment, and if your pigmentation is in the upper layers of the skin, the prognosis is not bad, but आपको मेहनत करना पड़ता है. So even if your pigmentation is becoming lighter or it has gone, you have to take care by putting sunscreen and applying those medicines prescribed by your dermatologist once or twice in a week. So, it's an ongoing treatment. You have to keep on taking care of your melasma always.
Right. We have another question coming up from Faria Beg. She asks, can you recommend any specific skincare products or routines to help improve my melasma?
For that, you'll have to come and visit me, because there are various creams which have got alpha hydroxy acids, beta hydroxy acids, retinols. So we usually give a combinations of AHAs, BHAs, and retinols depending upon your skin. There are so many things that we have to look before we prescribe the medicine for you. So I won't be able to tell you on this platform, but yes, please come in or go to any dermatologist for one consultation, which I've been telling you from the beginning.
Right. Well, I think, Faria, you have heard it for better, because we are here for a very limited time and we would like to cater to all the questions. so that you have a clear idea about melasma. But for better information and for better guidance, you can definitely visit her. We have Purvi Mehra asking us the next question. How can I protect my skin from further melasma development?
Eat well, sleep well, and put sunscreen well. So so it's very easy for me to preach, lead a healthy lifestyle, but you can at least try towards that.
Doctor, my personal question would be for you is any dietary changes which we can make to prevent ourselves from having melasma?
No, nothing as such is recommended in food as such.
Okay. With that, we'll move on to our next question. Our next question for you is melasma hereditary, a hereditary disease?
Yes, yes, I think to a large extent, whenever I take a history, there is someone in the family, mother, father, or sibling, who is suffering from melasma. To some extent, yes, it is hereditary.
Okay. We have another question coming up from Riya Sathi. She asks, is it safe to undergo cosmetic procedures like chemical peels or laser therapy for melasma?
Okay, so there are various procedures which are available. You can go for chemical peeling, you can go for dermabrasions, you can go for derma rollers, you can go for hyaluronic acid fillers and all. But unfortunately, nothing seems to be really, or Q-switch laser, nothing seems to be working for melasma. Chemical peels, I would say avoid, because your dead skin gets exfoliated, you get new skin, and you have to avoid direct exposure to the sun, which cannot happen. So when you go out in the sun after taking a peel, in fact, your melasma can increase. So I would suggest, in general, if you want rejuvenation of your skin, it's okay to go for all these procedures. But if you're looking for melasma management, then there is no point wasting money on these procedures.
Well, I believe, Riya Sathi, your question has been answered. Doctor, my personal question, like it's out of all the questions, what can be the worst case of melasma?
What can be the worst case of melasma? Like you can have patches, big patches on your cheeks. You can have them on the upper lip, on the eyebrows, sometimes on the chin also, and it can cover up quite a large surface of your face.
Well, as far as we know, it's not painful. Melasma is not painful.
Not at all.
Yes, it's just an appearance. Brings a change to your appearance. But is applying makeup on your skin, can it be harmful for melasma by any means?
No. For melasma, it is not harmful, but you can land up having acne form eruptions, etc. And but you can conceal your melasma. There is no harm. But I always tell my patients that you have to invest money in buying a good base. It should not harm your skin. It should not block your pores. So you have to invest money on buying a good base.
Right. Doctor, speaking of good base, there are a lot of tubes and first copies, in copies, third copies in the market nowadays. I know there are a lot of viewers who thinks, I have also met girls who are like, you will see there are no difference between both the foundation or both the base. What do you have to say to those people, who has such sort of mindset?
So everybody seems to be using a thick layer of makeup day-to-day basis. I tell my patients that please do not wear makeup daily. Do a good lip makeup, eye makeup. But, over the face, do it only if you're partying. If people put makeup when going to the mall, when going for a movie, I think you should avoid it. If you are if you are on the screen, or if you're in a glamour industry, then it makes sense you have to put makeup. But otherwise, and there are professional hazards, so they have to bear with it. But otherwise, avoid base as far as possible. But if you have an acne prone skin, you have to buy a base which says, okay, water based, non-comedogenic. So from a good brand, I usually suggest buy either from Clinique or Estee Lauder. Yeah.
Right. Doctor, I think as far now we have almost, answered all the questions. And if anyone would want to ask, like we have already got the answer from you that melasma cannot be completely treated. But in your experience, have you found any patient so far whose melasma has been treated completely?
All right. So I have an example of my mother at home. She suffers from melasma, and she knows if she puts the medicine, the pigmentation disappears completely. And if she doesn't put it for a week, it comes back. The day she's out in the sun, it looks darker. And I have seen with my own eyes that the day she's inside and she's doing the treatment, it completely disappears. So as I said earlier, it's an ongoing treatment. It does go, but it does come back. So there are good days, bad days.
Well, I think to phrase it, it's like a baby, you have to continuously take care of it. So once the moment you stop taking care of it, it appears again and again. So that is why doctor today is saying that it cannot be completely treated. You cannot just sit back and lay and then think that your melasma won't come back. One fine day you get up and then you feel all okay, and then the next day you think that, oh, it's not going to appear. But no, it's not like that. You have to take care of it. Doctor, if there is any take-home note for you, for our viewers today, what would that be?
Okay. So there are other causes of pigmentation. There are a lot of people who have ashy dermatosis, lichen planus pigmentosus, toxic melanosis, pigmentation because of using perfumes. So what I want to tell everyone is that you have to rule out other causes of hyperpigmentation, because there are other causes which can be managed easily. So don't think that all hyperpigmentation is melasma. Let's not treat it. It doesn't work like that. There may be other causes of hyperpigmentation. Please go and get the diagnosis made and take the treatment.
Well, right. Well, viewers, that was Dr. Nidhi Rohatgi for us with her expertise on melasma. We have heard a lot about these, severe disease, which is very commonly arising in almost maximum of the women and also men. We have come to know about few of the things which we can do to change, to get rid of it, not completely, but of course, take a good care of it. So I think that's all for today. If you want to know more about melasma and if you want her expertise, you know what to do. You have to definitely contact her. Doctor, I would personally like to thank you for joining us, for your valuable time. And thank you so much for this very informative session for our viewers. It was great to hear from you. And we look forward to many more such sessions for our viewers in the coming time. Thank you so much for joining us. For all the viewers, thank you so much for your active participation today. We would love if you would stay connected with us on our official page of Beautiful Spotless Skin. Thank you so much. It's your host. Have a great day and stay healthy. Thank you.